Hello, everyone. Sarah and I have taken an initiative to record a DDR for you. This is on diverticular disease. And as you can see, that Sarah has done a lot of work and she's made this document where she's written down what she's talking about, how she's explaining her DDR, so that you have a better idea as to what's going on. Sarah will be the dietitian and I'll be the patient and we will be doing this brief DDR recording for you. So over to you, Sarah.
Thank you, Rati. So, good morning, Rati. My name's Sarah, and I'm the dietitian. Your doctor's asked me to have a chat with you today because you've recently had a diagnosis of diverticular disease. And what we're wanting to do is have a little chat about what you can do in relation to changing your diet to help that. So, what I'd first like to ask you, Rati, is what you already know about diverticular disease.
I'm not very sure, Sarah. It's a very fancy term. But I think my friend was telling me basically what I have is ulcers in the intestine, and that is why they are painful. But yeah, I think maybe it's ulcers.
Okay, so thank you for that. Well, it is something along those lines, but what's important to understand about diverticular disease is that it affects the lower part of your digestive system, the part that we know as the colon or the large bowel. And what diverticular disease is when little pockets or small pockets develop in the lining of your colon. And when these pockets become inflamed and infected, this is what causes those uncomfortable symptoms of diarrhea and pain that you've been experiencing. And that inflammation is actually what we call diverticulitis. Now, in relation to your diet, what we need to look at is the fiber. So we would be encouraging you towards a more high fiber diet. Now, what fiber is the edible portion of plants that are not digested or absorbed in the bowel. And what they do is they add bulk to the stool, and they also take up water, which helps you to pass the stool more easily and prevent constipation. Now, preventing constipation means that the stool is moving better through the colon, and that reduces things getting caught in those little pockets, and therefore reduces what we call a flare up of the diverticular disease.
Okay. Sarah, if I understand correctly, and yes, constipation is something that I have been struggling with for so many years. So I definitely want your advice on how best I can get rid of my constipation. But this is very confusing, Sarah, because when I was admitted in the hospital, I was advised to have a low fiber diet. But now, as you have said, I need a high fiber diet. This is very confusing to me.
Okay, so yes, it is a bit confusing quite often for patients, but when you have a flare up or what we call a flare up of your diverticular disease, a low fiber diet is recommended so that it helps to allow your gut to heal a little bit before, obviously while you've been suffering those uncomfortable symptoms. Now, from what I understand, your symptoms of the diverticular, the pain and the diarrhea have started to settle. So it's now important that we slowly increase the fiber content of your diet to prevent constipation. And this should help prevent further flare-ups in the future. So I'll just explain to you a little bit about what those high fiber foods might be. So when we talk about high fiber foods, we think of things like fruits and vegetables, the wholemeal and whole grain food options such as wholemeal or multigrain breads, whole grain cereals, wheat bix or oats, that sort of thing. Now, thank you for completing the food diary and bringing that with you today. And I can see that you have been following a low fiber diet from your hospital admission, and that means you've been having foods such as the white bread, rice bubbles. You've been avoiding the fruits, and your portions of vegetables and salads are very small. So what I'd like to talk you through today are some suggestions on how we can slowly increase the fiber content of your diet. So the first thing I was thinking you might be able to change would be to change from the white bread to wholemeal or whole grain bread for the toast in the morning.
Sorry to interrupt, Sarah, but I'm a bit confused over here because when I Googled up foods about diverticulosis and foods related to diverticulosis, I came about some websites which said that I should not have things such as multigrain bread or popcorn or seeds and nuts because they will stick into those ulcered pockets. The what you explained, that these pockets which are there in my intestine, and then this will increase my diverticulosis. So I'm really worried that what will happen when I take such foods with seeds and nuts.
So yes, a lot of people find that if you do look on the internet, you'll find that a lot of websites will suggest that you need to stay away from the seeds and nuts and skins and that type of thing. So what's happened is we've done more research in relation to diverticular disease, and there's no real evidence now to suggest that avoiding those foods will prevent a flare up or even make a flare up happen. So it's much more important now for us to manage that constipation that you've probably been experiencing previously. There's a lot more evidence that will actually help you have any further issues down the track. So if you're happy, we'll just move forward and try and give you some suggestions how to do that. Now, the most important thing is that you do make those changes slowly, because obviously you've had a bit of an irritation and uncomfortable feeling in your colon. So we want to do that slowly. So not rushing out and eating lots of fiber all at once. So in addition to maybe changing to the wholemeal and the or the multigrain breads, you could maybe try that for a week or so, and then maybe start adding in a different cereal. So then you could maybe try the rice bubbles, change the rice bubbles to the oats or the wheat bix. And then you could try that for a few days and then add in some fruit, maybe just keeping to one piece a day to start with. And do that for a few days, and then maybe start to increase your vegetables and salads. So I can see that at the moment you're only having half a cup of those. So then you could start to increase to about a cupful of those. Now, in addition to the fiber, what's really important with diverticular disease, and any time you're trying to increase the fiber in your diet, is to make sure you're drinking enough as well, particularly water. So if you remember at the beginning, I explained to you that the fiber gives bulk to the stool, and it also holds water into the stool. So if we don't put enough water in, it's like a dry sponge, and that's not comfortable to pass. So I would suggest really trying to get through maybe 6 glasses of water a day to ensure that you can have a nice, easy bowel movement. So I've got a resource here which summarizes what we've talked about, and that might give you some additional ideas with your diet. So you can take that home with you. Do you have any questions at the moment?
Not at the moment, Sarah, but this clears a little bit of my misunderstanding, and I think I'll give it a go and see how I do with it. Yes, I would like to try this new diet, which is including fiber that you have advised, and see how I go with it.
Excellent. What I'd really like. No.
Dietitians are very busy students, so this may happen. It's all good.
Sorry about that.
It's okay.
Right at the end. So I was just going to say, have you got any questions? And I'll give you a food diary to complete for the next 4 weeks, and we'll meet again then.
All right. I'll see you in 4 weeks, Sarah. And yes, I'll maintain a food diary. I know how to do that now, so that won't be an issue. Yes.
Excellent. Oh,
Yeah.
sorry
Thank
about that.
you. I'll just stop the recording now, students. And as you can see, this is how, this hopefully this will help you to understand how Sarah first covered the pathophysiology, the diet disease relationship part of explaining to me what exactly is the condition that I'm suffering from. And then she went to the dietary options, and she exactly told me few take home messages, clear take home messages, these 3, 4 things that I can follow and how to follow, which is not do everything at one point, but gradually take it into my diet. So this is how you can like comprehensively do your diet disease relationship. And as I have indicated previously, very happy for you to have a screen like this. And then you are like, taking these guiding points to help you like talk through the diet disease relationship. So we are still open for you to have this sort of a Word document, our PowerPoint presentation, so that your DDR can be guided. All right. So I hope this has been a helpful experience, and I'll stop the recording now. Thank you.
Thanks.